in fact, we have time for 10 minutes for questions. So we have microphones set up. We'd love for people to use these microphones so that others can hear. If you are mobility impaired, we have people with microphones who will come to you. So you just need to raise your hand in that case. And if you wouldn't mind introducing yourself very briefly. Are there any questions? Yes.
Fred Marsick, a microbiology consultant. Just, we still have this idea of looking at these microorganisms as individuals, which is important. But of course, we know now that, as you mentioned, and thank you very much for a very stimulating talk, that these things work in communities. But the research to address what can be done by a community that's been, quotes, invaded by something that doesn't belong there and cause disease is problematic, and perhaps maybe you can address some of the ways that we might be able to do that.
So thank you for your question. There are a couple aspects of your question. One of them is mindfulness of what this system really looks like and how it can become altered, even by the introduction of an invasive species. We've been led to believe you have a staph infection. That means you have staph plus everything else that you had before. Well, that's not really true. And in fact, there may be certain configurations of your microbiota that allow for staph to enter more profitably or more frequently, and we need to be aware of that as well. So that's one part. Another part is we need much better tools for responding. And I've already alluded to the fact that the antibiotics at hand right now have saved many lives, clearly, but they are all, almost to the one, broad spectrum. They impart collateral damage. We don't have many, if any, very few, specific drugs that target specific organisms, even if we could know that that was what it is we wanted to target. And so the diagnostics part is another big problem here, and the two go hand in hand. Without one, you don't have the other, without, back and forth. So multiple kinds of problems, and I think, maybe today we now have at least the awareness part at least on the table, and there may be approaches that would make sense.
Carol Seisler from Boston. Thank you very much for a wonderful presentation. There have been tremendous advances in understanding robust circadian rhythms in metabolism that are largely discussed in terms of the human side, in terms of circadian variations in insulin sensitivity and glucose responsiveness and so on. What about the microbiome? Is there much known about circadian variation?
Yeah, it's a really interesting question, and I'm glad you asked. It's now sort of an emerging topic of great interest. Laura Hooper, about a year or two ago, one of our organizing committee co-members, published a really interesting study looking at changes around the sort of the diurnal clock of activity and numbers of immune response cells, Treg cells in the gut, and postulated that, in fact, that might both determine and reflect changes that are ongoing in the microbiota. Gene Chang from the University of Chicago has published some work recently in which he has looked at these changes in the microbiota over the course of the day in mice where there's an opportunity to do so, and I think collected it sort of an early sense that there may be something happening even in that kind of time scale.
Thank you.
Joe Scherger, family physician from California. Two real quick questions. One is individual microbes don't live very long, and I had heard someone say that we have a turnover something like every 10 hours or so of our microbiota individual organisms. The other quick things is we have this tremendous emerging market of probiotics. Are they doing anything?
Okay, and now we have a lot of questions, so I'll try to be quick. On that first topic, so that's actually an interesting issue. Organisms in the human body generally don't grow anything like the rates that we measure in the laboratory. In fact, it's believed that there are many organisms in the gut that are close to dormant or periodically waking up for slow growth. Now, that's not to say that they don't get flushed, because we have both, motility issues in the gut, turnover of epithelia on the skin, the mouth. So there is a great deal of exchange and renewal. Are there reservoirs? Yes, there must be. And of course, this is a carefully choreographed story. On the second point about probiotics, we could spend a day, definitely, on that topic. And I think, in fact, we'll have time in the last session where we are going to talk about therapies and translational medicine in this area. My humble opinion, there's something there in probiotic medicine and biology, but we're nowhere near where we need to be in both selecting and designing probiotic-related strategies. There's a lot more that we could do, and I think sort of the humble results, inconsistent results, reflect the fact that it's very crude at the present time. Over here.
Ron Germain from NIH.
Hi, Ron.
I have a more sort of technical question, but hopefully the audience will appreciate it, which is that a lot of effort has gone into beginning to map genetic networks in individuals or individual cells, metabolic networks, protein-protein interactions. You're describing communities that now are interacting with separate gene sets but communicating with each other, sensing each other's metabolites, and so on. Do you see a path forward to actually getting a more global understanding at a detail level that you're talking about, where you can begin to model what happens when you perturb those communities, either with an invader or with a perturbogen, a drug, or something else?
I was hoping that you might have the answer to that one, actually. Well, I mean, a reflexive response is to say we're going to collect a lot more massive amounts of information. We're going to do all those kinds of measurements that I talked about, and then ask questions based upon what it is that we see or the questions that seem to arise. I'm, on the one hand, optimistic that we are able to collect important, useful kinds of information, and we're beginning to think about ways of integrating them thoughtfully. But we have a long ways to go, and there's a lot of noise right now and sort of data distraction. So this is going to be an ongoing struggle, and I think probably emblematic of many of these kinds of information science struggles in medicine right now. But this is maybe the poster child of it all.
Hi, Herb Partis, New York. First, thanks for a most articulate presentation. It really was terrific. Could you comment on how a decision maker looking at application of this work to various clinical areas would make a decision as to which areas to focus on?
Well, that's a simple question. There, I would say, lower hanging fruit and higher hanging fruit. Of the first sort, probably ways of stratifying patients and doing, again, risk kinds of assessments for likelihood of disease or likelihood of response to certain kinds of therapies, because those sorts of approaches don't necessarily require that we understand the why part. It simply it requires a well-validated predictive kind of understanding, in quotes. So I would say that's one place. Another is to simply start from some of the interesting small molecules that we're now discovering, which have been purified and studied to some degree and recognized as having really interesting properties. I would say there's a lot of gold in there, that still has yet to be mined. That'd be another area. We could go on. There'll be more
Great
discussion
talk,
of that.
thanks.
How much time do we have? 1 minute. 0. One says 0. Okay. One quick question.
My name is George Hill from Vanderbilt University School of Medicine.
Hi.
Yesterday we had a discussion in one of the interest groups on population health and health disparities, and Victor this morning talked about persistent health inequity. I was wondering what your thoughts were with regards to how the human microbiome might be able to address some of those issues and what some of the liabilities might be.
Right. That's a really interesting question and problem. To the degree that it's individualized or reflective of interesting, maybe poorly appreciated subsets of the population, this is an opportunity to now look objectively at who we are based upon this sort of mirror of genetics and history and environmental exposure. To me, it's an opportunity to sort of rethink what it means to be human in ways that don't necessarily get caught up in the outward visible features and in some of the sort of outward and somewhat biased kinds of historic clinical data collection. I don't mean to oversell it, but it's at least an opportunity to think again about an independent, maybe complementary approach to, again, classification, risk stratification, and understanding biology.